Hello, Ashburn Elementary School. My name is Dr. Matt Jepson, and I'm a sports medicine physician. I've been asked to talk to you guys today about what I do and what it takes to become a sports medicine physician. So my job is to take care of active people who use their bones, joints, to do pretty much anything. So people who play sports or people who just want to walk around and go outside and have fun and play with their friends. What on earth do you have to do to become a doctor? So I'm a very specific kind of doctor. First, you have to finish school, finish high school, and then go to a four-year college and get a degree. From there, you have to take a big test called the MCAT and go to medical school. That's another 4 years. We're already at 8 years after high school. From there, you apply and you can get a job in a residency program. The kind of doctor I am, I went and became a family medicine doctor. So 3 more years of school there, and then I did some extra training to become a sports medicine physician. That was 1 more year. So that's a lot of school in order to be able to do some pretty cool stuff. My job every day involves going to the office and seeing people in my clinic. What we do is we check out their bones, ligaments, and joints and take care of things like broken bones and sprained ligaments and tears of tendons and things of that nature. I don't operate on anybody, but I do have friends who are surgeons, and they will take care of big problems that require surgery. But a lot of people don't need a surgery. They end up just needing a little bit of physical therapy. And so I work with my friends, the physical therapists, here at my job. And what they do is they work with people to get them back to being active and healthy and doing what they want to do. So another part of my job is I take care of concussions. You may have heard about those watching any sort of sport you enjoy, such as watching on ESPN and watching a football game. That's when someone gets hit in the head and they just don't quite feel right. And so I help those people get back to playing sports as safely as possible. I also do some things that involve the use of an ultrasound. That's a special piece of equipment that lets me look inside your body and find out if anything's wrong with a muscle or tendon. And sometimes I'll even do injections, but not on kids. I also take care of sports event coverage. So, for example, this past weekend, I was on the sideline for some football, and you help take care of anybody who may get hurt or injured there, answer questions, let them get back to playing as safely as possible, or remove them from the game if they're having trouble. One of the biggest things you have to do to be a doctor is you have to study hard, and you have to be able to work with a lot of different people. My job is mostly about communicating well. I work with athletic trainers, I work with other doctors, I work with physical therapists, I work with all kinds of staff, including the young lady who's helping me shoot this video. I was also asked to let you know what the biggest challenge is. I would say the biggest challenge we have is managing your time. So I have to be a lot of places at once, and I have to make sure I do it all correctly and make sure that I am doing the right thing for everybody. Another thing is I work a lot of nights and weekends, but you know what? It's fun because I'm on the sideline for some fun sporting events. So if you want to be able to do sports and be a doctor, being a sports medicine physician is a nice, fun way to do it. And you guys have a great day. If there are any questions, please reach out to your teacher, and I'm more than happy to answer any more. Have a great day, Ashburn Elementary.